Welcome to a special edition of For the Health of It from HLTH. I'm Bill Evans, and I'm joined by Missy Krasner, Venture Chair of Redesign Health. Thanks
Hi.
for joining us.
Thank you for having me. It's great to be here.
So we're going to start with a tough question. Your moniker is the healthcare hustler. Tell us how you got that name and what it means.
Yeah, it's really funny. I'm glad that you brought that up because it's probably something that I need to revisit since I'm getting older, right? Been doing this for about 35 years. I really came up with that moniker back in the day. So I was the first Google Health team, very, very early days. And then I spent a little time at Box during our IPO. And then my last big tech company was Amazon, all healthcare teams,
Sure.
So I think, a lot of, and now I did a little short stint in venture at Morgan Thaler Ventures, which is now called Canvas Ventures. We did Practice Fusion, we did Doximity Series B, HealthLoop, Vita Health. Someone who's a hustler now, you think of founders, you think of folks that are like out there hustling, they're like getting their money, they're like not taking no for an answer, they're selling. And for me, being a healthcare hustler and being an intrapreneur, someone who was doing this inside of big tech, really having to constantly influence. You learn the art of influence. You learn how to educate other folks. You learn how to really try to teach people about the culture of change management in healthcare, which, as you know, it's super hard, super unique. So that's kind of where I invented it long ago. And it's just sort of been up there. And, I would say that I have not been a hustler in the traditional, I'm a founder and I need to go out and hustle for.
Well, there's a pool table in the room next door. If you want to play for money.
There we go. Right. That hustler. Yeah. Indeed.
So you were quoted in something where you started saying, I don't think big tech is going away in healthcare, despite many of the headlines. And obviously here at HLTH, there's a thriving sort of disruptive startup community.
Yeah.
So given your role in intrapreneuring change inside of big tech, how do you see the dynamics of scrappy startups that are reinventing the game versus the need for change in big tech and your role specifically? What is the trend there and how do those two things either collide or work together?
Oh, I love that question. That's kind of in my sweet spot. So let me start off by saying the perfect sort of intersection of all of my career, a little bit of government, a little bit of big tech, a little bit of venture, a little bit of startup operating, right? I have now landed in a company creation platform, which is Redesign. We are in the business of launching companies, seeding them, we conceive them, we research them, we seed them, we launch them, we fund them. Once the company is funded, I jump in as a venture chair. Think of me as a operating partner or professional board member. I go out and hire the whole leadership team the founding team, CEO, COO, CPO, right? Once they're in, we consume a lot of services around Redesign to get them into an MVP. And then they go out and fundraise. After our seed capital, they go out and do a Series A, right? So I have all day long, we have more than 24 companies in our portfolio and another 7 or 8 coming out of stealth, right? So all day long, I'm in that cross section of agile, new ideas, company creation. And that is the bread and butter of what the Googles and the Amazons will constantly be looking at, either to acquire, to have an 18 to 24 month hopscotch in their product roadmap, right? Or to fund, because they do have funding mechanisms, particularly Amazon. I was at Alexa Health and Wellness for a while. We had an Alexa fund for voice forward companies in healthcare, not exclusively healthcare. So I think big tech, if you see the news today of what Amazon launched with its Amazon Clinic, right? Look, there's lots of layoffs, there's lots of constriction, there's lots of buying because of where we are in the market. But basically, I think big tech and retailers are going to be making tons more acquisitions. And I think that pushes the incumbents forward, right? At a much faster clip than they would if it's retailers and big tech. That's where I think the new buyer is.
So you're giving a talk here at HLTH. Why don't you tell us a little bit? You'll have already given it by the time this airs. So you won't be revealing your secrets. Talk a little bit about what your topic is and what
actually, so I was just on a panel with Chrissy Farr from OMERS, who used to be, in the media and the reporting side, was our moderator. And the title of it was Doom, Gloom, or Boom.
Wow.
Is digital health over, right? And, what's next? And I think we had Jonathan Bush on there, who's, a veteran with Athena Health and now at Zeus. We had a couple investors, a couple people from the public market. And I think what we're really seeing is, a pendulum swing. We're in a post-pandemic time in the market right now. For the first time in my career during the pandemic, we saw the digital wide door opened and we had a ton of innovation. Like the first time we saw
Yeah.
a rapid clip of innovation, the entire healthcare delivery system was falling apart. Access became a huge issue, right? Home diagnostics, moving care from the hospital to the home. And so it was this explosion, right? You had these mega deals getting done at these very high valuations. And now I think we're in a course correction, right? You've got global inflation, you've
Right.
got this sort of deflation of the SPAC, right? So I still see a lot of deals getting done. And what we were talking about is what's happening in this new environment. How are deals getting done? What are investors looking for, right? What are you coaching founders who are actually doing seed stage startups to think about?
Right. So in your position, you have a number of companies that you advise. I know several of them are working on addressing disparities of care, closing that gap. What is either the trend you're seeing of how technology is playing a role,
Yep.
or what are you most excited about technology being able to address to make a more equitable distribution for patients?
Yeah, I mean, this is like definitely something that you guys are doing a lot of really great work in. But I think we're seeing a very interesting kind of competitive pressures coming out of the Medicare Advantage market, and that is a true D2C shopping experience. And once you get the member, you need member engagement. So I think there's this whole new role for SDOH data, this whole new role for getting it, right? Data enriching it with a whole bunch of other, whether it's structured data, right, from the EHR, it's claims data, lifestyle data, genomic data. It's super interesting. And so we are spending a lot of time at Redesign looking at new companies. And I think if you throw the Surprises Act, which, we're just at the first inning, so we don't have a ton of payers and, health systems posting like great data sets.
Right.
They're kind of messy, right? You guys would know this more than anyone. But I think that's also really interesting as you start thinking about transparency and moving that category forward, procedure shopping, because you're starting to see some of the things that were always under gag order, right? You couldn't, it was always super opaque. So I feel like there's some really interesting data plays on the horizon.
So as we've been having a lot of these chats, we're getting a lot of perspective on the startup community in general. Some people are very bullish, some people are very bearish. One of our interviewees commented that they don't think a number of these companies are going to be around in 2 years. What's your thoughts on the state of the market right now?
I think that's sort of a funny sentiment. Like, everybody knows that 50% of startups fail. It doesn't matter what industry you're in, right? The point is that you need innovation, you need transformation, particularly now, right, post-pandemic. So I personally think that there are some very particular themes right now that are very ripe for startup work, particularly the transformation to value-based care. So a lot of really companies that are trying to really sort of ride that wave and like be positioned where we're going to be seeing more tooling around that. I also think that anything in elder care right now, huge. Anything that's serving the Medicare Advantage market is really, really well positioned, given where we're going with all of those plans. And I think there's a lot of really interesting things. While crowded, there's a lot of really interesting things that we've learned in the last couple of years on behavioral health. Last thing that I would say is there's a lot of sort of brewing and talk around, there's too many like specialized point solutions. These are niche players. They're not going to be around. Well, what you will see in the market in the next year is a lot of consolidation, a lot of tuck-ins. So you might find a company that's figured out how to do something in like a very supply constricted specialty, like neurology, cardiology, right? That has, done something really interesting and innovative, and another bigger company is going to need that as an adjacent market, right? And they're just going to do a tuck-in. So startups might not be around because they're getting bought, right? And whether it's a change of control that's a really good exit or it's a moderate exit, like the innovation will get picked up.
Right.
And if it doesn't, you have a great learning from it. So I tend to be a little bit more hopeful about that.
Awesome. So last question, what is the most interesting thing you've seen at HLTH thus far?
I had someone, this is super random. I was in the elevator. I had someone walk up to me and knew me from my Amazon days and had a device in his hand. And the device actually did two things. The first thing it did is you put it on your head and it could tell you if you had a concussion in the past.
Oh, wow.
Yeah.
That's bananas.
And it was totally bananas. And the second device was being able to take a hair, like a piece of hair, like literally just pluck it out of your head, put it in this like little compartment, and it would analyze your hair, and it would tell you what kind of nutritional deficiencies you had.
Oh, wow.
Yeah. And literally, I was in an elevator, so those two things happened.
In the elevator?
In the elevator. I mean, there's a tremendous amount of interesting things, but there's also like a lot of companies that we've seen that sort of, started 2 or 3 years ago. We haven't been able to see them during COVID. They've made progress, right? Tons of people that have done great things in behavioral health out on the floor.
Yeah.
We're seeing lots of the big companies doing stuff there. So in a sort of post-COVID world, it's really interesting to see like what companies have really grown up.
Yeah.
That started pre-pandemic.
I don't know if that's a testament to the efficiency of the pitch or the slowness of the elevator, but that's very interesting.
Yes. Yeah. Well, it's always fun when you have a gizmo in your hand, right? Because people are more willing to be like, oh, you want to pluck a piece of hair out?
Right.
Like, yeah.
Let's do it.
It's really interesting. Yeah.
Well, thanks for spending some time with us.
Yes.
It's great to see you.
Yes. Thank you very much for having me. Thank you very much.